My name is Charlie Boggs, and this is my IV fluid skill competency. So first, I have my patient's MAR printed out. It is for Davis Ellen. Date of birth is 9/19/1965. She has an allergy to pollen, but no known drug allergies, and she's due for two fluids time now. So the first is sodium chloride 500 milliliters. So I have here sodium chloride 500 milliliters. That is to be given 125 milliliters per hour via gravity using 10 drops per milliliter tubing. That math would be 21 drops per minute, but the tubing that I got in my nursing kit came with 15 drop per milliliter tubing. So the drop factor I'll be using today to get an accurate administration is going to be 31 drops per minute. The next medication that I have is cefazolin sodium, 1 gram in IV piggyback in 50 milliliters over 30 minutes in the same drop factor tubing of 10 drops per minute, and my secondary tubing is also 15 drops per milliliter. The math for 10 drops per milliliter would be 17 drops a minute, but the 15 milliliter drop factor tubing that I have, the math will be 25 drops per minute to give that over the correct time frame. So I'm going to inspect my medications. My sodium chloride is expiration date of 5/27, so that is good. It's not expired. I don't see any floaties or particulate in the solution, and the package is intact. That was my second check. And then for my cefazolin, I have cefazolin 1 gram in 50 milliliters, and I have here, I'm actually going to label it. I have here cefazolin 1 gram in 50 milliliters. The expiration date is 6/20/30, so not expired. Packaging is intact, and I don't see any floaties or particulates. This medication is good to go as well. I've done my 2 checks, and I have all of my supplies. I'm now going to go into my patient's room to administer these fluids. So I've entered the patient's room. I've closed the door or curtain behind me to ensure privacy. I'm going to introduce myself. So, Ms. Davis, my name is Charlie. I'm going to be giving you some medications in your IV today, some fluids. Can you verify your full name and date of birth for me? She's going to tell me Davis Ellen, 9/19/1965. I have here Davis Ellen, 9/19/1965. Do you have any allergies? She's going to tell me pollen, but there's no known drug allergies, and then that matches, both of those match her armband and my MAR that I have. So I'm going to begin preparing the primary infusion of normal saline. With my third check, I have normal saline, 500 milliliters, and sodium chloride, 500 milliliters, sodium chloride, 500 milliliters. So I'm going to get my tubing. I'm going to make sure that my roller clamp is closed. All right, so that is closed. I'm going to invert my bag and remove this cap, maintaining an aseptic technique and not touching the port of entry for this bag. And then removing the cap for the tubing, not touching the spike. And then put in there. I'm going to hang this. Squeeze my drip chamber to at least half full. That looks good. And then I'm going to prime the tubing to ensure there's no air in the line. So we'll open that roller clamp. All right, so that is primed. There's no air in my line. I'm going to keep the cap on the end of that tubing there. and assess my IV site. So I'm going to wash my hands. I'm going to don clean gloves. And I don't need to flush this IV because it was just inserted, so we are just checking. I don't see or feel any signs of infiltration. Site is clean, dry, and intact, no phlebitis, no erythema. We're now going to connect the primary infusion of normal saline. So I'm gonna grab an alcohol swab and vigorously scrub the needleless connector. That's now clean, so I'm not going to let it touch her skin. I'm going to remove the cap from the end of the tubing and connect the two. That is secured. I'm going to remove my gloves and wash my hands again. And then we're going to open the fluid and count out my drip rate. So again, I need 31 drops per minute because of my 15 drop factor. So we're going to open, guesstimating about 5 drops every 10 seconds, and count this out. So we're gonna start now. So let's do one, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30, and 31. So that looks good. I'm going to leave that where it is at that drop factor. I'm going to wash my hands and prepare the cefazolin. Alright, so for my third check, I have here cefazolin 1 gram and cefazolin 1 gram. It is in 50 milliliters. We're going to get that at 25 drops a minute. So I'm going to grab my tubing. Make sure that my roller clamp is closed. Okay, and then same thing here, I'm going to remove that cap, ensuring not to touch that port, and then remove the cap from the tubing and spike the bag. Okay, going to hang that. And then we're going to squeeze my drip chamber to at least half full, and then prime this tubing as well, ensuring there's no air in the line. Alright, so that looks good. And then before connecting that to the primary, we're going to make sure the primary is hanging lower than your secondary. I'm going to wash my hands and assess the site now that we have fluids running. So I'm going to grab a pair of clean gloves. Alright, so looking at the site, I don't see any redness or leakage. The area and the dressing is clean, dry, and intact. I don't feel any signs of infiltration or phlebitis, and again, there's no erythema. So our site is still patent and it is dripping. So that looks good. I'm going to remove my gloves and wash my hands again. It's now time to connect the secondary to the primary tubing. I'm going to grab an alcohol pad, find the Y port on this tubing, which is here. I'm going to scrub this site vigorously, make sure that it is clean. Same as the arm, I'm not going to let that touch anything because I just cleaned it. We're going to remove this cap from this tubing and connect the two. Okay, clamping the normal saline so that this doesn't run. We're going to open the cefazolin, okay, and then we're going to count our drip factor from the roller clamp on the primary tubing. So we are looking for 25 drops per minute. So we're going to all right, we're going to start that now. So we have 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, and 24. That would have been 25 drops per minute. So we're going to leave that running at its rate of 25 drops per minute. I'm going to wash my hands again so that we can assess her site now that both of them are running. Make sure my hands are dry. Put on a pair of clean gloves, excuse me. And assess the site for signs of infiltration. I don't see any, I don't feel any hardness. The dressing is still clean, dry, and intact. We are still flowing good. So I'm going to remove my gloves and wash my hands, and then I'm going to ensure proper documentation of both of these fluids.